Things are not looking good for the growing list of fraud investigations shaking Minnesota. What began as isolated allegations has expanded into a sprawling web of raids, audits, and criminal cases that are forcing uncomfortable questions about how millions of taxpayer dollars flowed through programs that were supposed to help vulnerable families, children, and seniors. Critics argue this wasn't simply a case of a few bad actors exploiting loopholes. They believe the warning signs were visible for years, ignored by officials who should have been paying closer attention. Now, as investigators continue digging through records and conducting searches across the state, the scale of the allegations is becoming impossible to ignore. During a recent address, Minnesota Governor Tim Walz called on lawmakers to pass legislation aimed at combating fraud and strengthening oversight. The message was clear. If lawmakers are serious about accountability, they need to support measures that prevent abuse of taxpayer-funded programs. But that call immediately sparked backlash from critics, who argue that many of the policies now under scrutiny were implemented during his administration. To them, hearing demands for more oversight sounds ironic when they believe the system already had plenty of opportunities to catch problems before they grew into major scandals.
At the center of the controversy are a series of federal investigations targeting organizations that received significant amounts of public funding. In several cases, investigators executed search warrants, seized documents, and began examining financial records tied to facilities that appeared to have received millions in government reimbursements. Neighbors, local residents, and journalists visiting some of these locations reported confusion over how businesses operating from seemingly inactive properties could have generated such large payments. Those observations have only intensified public curiosity about how the funding approvals were handled. One particularly unusual encounter involved a property owner who appeared reluctant to provide even basic information about himself, while journalists attempted to verify details about businesses operating from his building. The exchange raised eyebrows because it highlighted a recurring theme in these investigations: a lack of transparency. Reporters repeatedly found themselves asking straightforward questions and receiving vague answers, creating the impression that many of the individuals connected to these operations wanted as little public attention as possible.
The questions became even louder when investigators focused on facilities connected to daycare and adult care services. Public records showed that some locations had billed government programs for substantial sums of money, despite appearing inactive to nearby residents. Neighbors described rarely seeing clients entering or leaving the facilities, while others questioned why businesses receiving millions in taxpayer dollars appeared to operate from locations that lacked the professional appearance people would typically expect from organizations providing essential care services. Financial records added another layer to the story. Some businesses reportedly received millions through child care assistance programs designed to help working families afford care. Others billed Medicaid for adult daycare services and related programs. Critics argue that these reimbursement totals should have triggered greater scrutiny much earlier, especially when combined with concerns about occupancy levels, staffing, and the apparent lack of visible activity at certain locations. Investigators are now examining whether those concerns point to administrative failures, criminal misconduct, or both.
As journalists continued tracing connections between different businesses, they discovered that several organizations appeared linked through common ownership, management, or addresses. In some instances, multiple entities operated from the same office suites, shared branding elements, or maintained overlapping business records. Former prosecutors and fraud experts have pointed out that while such arrangements are not inherently illegal, they can become red flags when investigators are attempting to determine whether public funds were used appropriately. The pattern of expansion has also attracted attention. Rather than operating a single facility, some individuals associated with the investigations appeared connected to multiple locations and multiple programs. Critics argue that once organizations learned how to access government reimbursement systems, they rapidly expanded their operations. Supporters of the businesses counter that growth alone proves nothing, and that expanding services is a normal part of running successful organizations. Determining which explanation is accurate is now part of the challenge facing investigators.
Complicating matters further are questions about who exactly was responsible for overseeing these programs. State agencies have explained that certain positions connected to licensed facilities do not automatically trigger background checks or deeper investigations.
That revelation surprised many observers, who assumed individuals associated with organizations receiving public funds would face extensive vetting. Critics argue that the absence of stronger safeguards created opportunities for abuse, while defenders of the system say existing regulations were designed to balance oversight with operational flexibility. The controversy expanded beyond daycare operations when federal investigators conducted raids involving autism service providers and other healthcare-related organizations. Once again, journalists uncovered networks of businesses connected through shared management structures, addresses, and financial relationships. Some former officials noted that investigators often follow these patterns because they can reveal whether questionable practices were isolated incidents or part of broader organizational strategies spanning multiple programs and locations.
As more details emerged, public frustration began shifting toward political leadership. Opponents questioned why prominent elected officials appeared relatively quiet, while headlines about raids and fraud allegations dominated local news coverage. Supporters responded that leaders should avoid commenting extensively on ongoing investigations and allow law enforcement agencies to do their jobs. The disagreement reflects a larger political battle over responsibility, accountability, and whether state officials acted aggressively enough when early warning signs first appeared. The debate intensified because the allegations involve programs created to provide assistance for childcare, healthcare, and family support. These services are generally popular with voters and are often presented as investments in communities and working families. Critics now argue that weak oversight allowed bad actors to exploit those programs. Supporters counter that the existence of fraud does not invalidate the programs themselves, and that strengthening enforcement is preferable to abandoning services that many families rely on every day.
Another issue drawing attention is the role of repeat offenders and individuals with prior criminal histories. Critics argue that basic due diligence should have identified potential concerns long before public funds were distributed. They point to cases where people connected to organizations reportedly had previous encounters with law enforcement or histories involving financial crimes. Whether those connections directly influenced the alleged fraud remains a matter for investigators, but the revelations have fueled calls for stricter screening procedures. The political implications are becoming increasingly significant. Opponents of Governor Walz and other Democratic leaders argue that the investigations expose systemic failures in governance. Supporters maintain that fraud exists in government programs nationwide, and that uncovering misconduct demonstrates that enforcement mechanisms are functioning. Both sides are attempting to shape the public narrative, knowing that the outcome could influence future elections, public trust, and debates over how social programs should be managed.
For now, the investigations continue, and many of the most important questions remain unanswered. Federal authorities are still reviewing records, conducting interviews, and determining whether additional charges will be filed. What is already clear is that the controversy has evolved far beyond a handful of isolated allegations. It has become a broader debate about government oversight, taxpayer accountability, and whether warning signs were ignored for far too long. As more evidence emerges, the final picture may reveal not only who benefited from the alleged schemes, but also how the systems designed to protect public money failed to stop them sooner.